Hi all, today's topic is fever. Fever is a very common and frequent symptom of many diseases. At the end of the session, the learner will be able to define fever and other abnormal variations of temperature, its mechanism, types, causes, complications, and how to diagnose and manage a case of fever. Fever is basically defined as an elevation in body temperature. Technically, any body temperature above the normal oral measurement of 98.6 degrees Fahrenheit or 37 degrees Celsius is considered elevated. Fever is not considered medically significant until body temperature is above 100.4 degrees Fahrenheit. Or anything above normal but below 100.4 degrees Fahrenheit is considered a low-grade fever. Fever serves as one of the body's natural defenses against bacteria and viruses that cannot live at higher temperatures. So we can say that in a way fever is, or a high body temperature is useful for us in fighting against infections. The body's defense mechanisms seem to work more efficiently at a higher temperature. Fever of 104 degrees Fahrenheit or 40 degrees Celsius or higher may be dangerous, demanding prompt medical attention. Such a high temperature can result in delirium and convulsions, particularly in infants, children, and the elderly. How fever affects the immune system of our body. It decreases the growth and reproduction of bacteria, lowers the amount of iron to bacteria, it enhances neutrophil migration towards the site of infection, it increases production of superoxides which can kill invading microbes, and it also promotes T lymphocyte production. So basically all these features, they help in fighting against infection and they are protective mechanisms. How fever occur? What is the mechanism behind the elevation of body temperature? Fever is the result of an immune response by the body to a foreign invader. These foreign invaders may be viruses, bacteria, fungi, drugs, or other toxins. They result in the production of fever-producing substances which are called pyrogens, and these trigger the body's immune response. Pyrogens signal the hypothalamus in the brain, where the temperature regulation center is located, to increase the body temperature set point in order to help the body fight off the infection. Hyperthermia. Hyperthermia is a defect in our body's response to heat. That is, it is a defect of the thermoregulatory mechanism of the body. It is usually caused by external sources such as being in a hot environment. There are many causes of hyperthermia. Some of these are heat stroke, drug-induced hyperthermia, serotonin syndrome, some hormonal disorders, and sometimes brain damage or brain injury can cause hyperthermia. How a fever differs from hyperthermia? In fever, there is a change in the hypothalamic set point, whereas in case of hyperthermia, the thermoregulatory mechanism of the body is failed. Fever involves cytokines, whereas there is no such mechanism in cases of hyperthermia. There are diurnal variations in fever, whereas diurnal variations are absent in hyperthermia. Fever rarely exceeds 41 degrees centigrade. However, hyperthermia usually exceeds 41 degrees centigrade. Complications are rare in cases of fever, whereas hyperthermia can be proved detrimental and fatal. Fever or elevated body temperature can be caused by many triggers. It may be a virus or a bacterial infection. It may be caused by heat exhaustion, extreme sunburn, Some inflammatory conditions, for example, rheumatoid arthritis, a malignancy can cause elevation in body temperature. Some medications, such as antibiotics, some anti-epileptics also causes elevation of body temperature. Immunizations, some vaccines like diphtheria, tetanus and DTaP or pneumococcal vaccine can cause elevation in body temperature. Some hormonal disorders, for example hyperthyroidism, and illegal drugs such as amphetamines and cocaine can cause hyperthermia or elevation in body temperature. There is an entity which is known as fever or pyrexia of unknown origin, FUO or PUO. In these cases, the cause of fever can't be identified. If a patient has a temperature of 101 degrees Fahrenheit or higher for more than 3 weeks and no cause is found, after extensive evaluation, the diagnosis may be fever of unknown origin. Hyperpyrexia is another abnormal elevation of body temperature. In this case, body temperature rises above 106.7 degrees Fahrenheit. It is considered a medical emergency and requires immediate medical treatment. Causes include brain hemorrhage, tumor or intrinsic hypothalamic malfunction, and severe infection. Signs and symptoms of fever: shivering, shaking, chills, body pains, aching muscles and joints, headache, intermittent sweat or excessive sweating, rapid heart rate or palpitations, skin flushing, feeling faint, dizzy, eye pain, weakness, and with very high temperatures, sometimes convulsions, hallucinations or confusion. Some of the symptoms that would suggest a major illness are headache, stiff neck, confusion, problem staying awake, which can be suggestive of meningitis. Shaking, chills, burning with urination may point towards urinary tract infections. When the fever is associated with cough and shortness of breath, it may point towards pneumonia. Repeated vomiting, severe diarrhea or skin rashes could be a sign of dengue fever, Rocky Mountain spotted fever, scarlet fever, rheumatic fever, or chickenpox. Herp angina or fever blisters. They are marked by small blisters that turn into ulcers, usually found on the lips, mouth, or tongue. There are 4 types of fever: continued, intermittent, remittent, and relapsing. Continued, which continues throughout the day and night, and it does not remit. Examples are typhoid fever, drug fever, malignant hyperthermia. Whereas in intermittent, the temperature falls to normal every day. This type of fever can occur in pyogenic infections, lymphoma, miliary tuberculosis. Remittent fever, which daily fluctuates more than 2 degrees and it does not return to normal, not characteristic for any particular disease. Relapsing fever, in which temperature returns to normal for days before rising again. This type of fever can occur in malaria, lymphoma, and pyogenic infection. Pregnancy and fever. Women who are pregnant should contact a doctor for a fever over 101 degrees Fahrenheit. A fever in pregnancy which is accompanied by a rash and joint pain could be a sign of an infection that could affect the baby. So it might be dangerous. Some infections such as cytomegalovirus infections can cause congenital deafness and other problems in the baby. So a fever in pregnancy should be dealt seriously. If a pregnant woman contacts contracts the Zika virus, also called Zika fever, it may cause a birth defect called microcephaly. There are many complications of fever if not diagnosed and treated promptly. It can cause severe dehydration. It may result in hallucination or fever-induced seizures. Fever-induced seizures are usually common in children. These are the normal body temperatures in mouth, axilla, rectum and ear. We can measure the body temperature at 4 places. The most popular method is oral measurement. It can provide accurate and reliable readings. It is generally recommended for patients 4 years and older who will not bite down on the probe tip during measurement. Drinking or eating very hot or cold food can affect temperature measurement through this method. It is important that the patient keep their mouth closed during oral measurements. Properly positioned in the sublingual pocket and the patient's mouth is closed. The other method, the rectal measurement, in this method, the probe tip should be inserted no more than ½ inches or 1.3 centimeters into the rectum. Water-soluble jelly or petroleum jelly should be used before applying the probe into the rectum. You should never force the probe tip if there is resistance. Axillary measurement. In this case, the probe tip is placed in the armpit. Bring the patient's arm down close against the body to trap body heat. The probe tip should be oriented in the same direction of the body with the tip towards the patient head. Additional measurement sites are in the ear canal. Tympanic ear thermometers may give slightly higher readings and the average temperature is around 99.5 degrees Fahrenheit. This type of method is ideal for small children. Temporal measurements are closer to true core body temperature. A case of fever should be diagnosed fully with the help of medical history and laboratory tests if required. After diagnosing a case of fever, the treatment should be to remove the cause. The elevated body temperature can be reduced by one of these methods. Non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen can help bringing a fever down, or if the fever has been caused by a bacterial infection, an antibiotic is used to combat infection. However, proper diagnosis and consultation is required if fever persists or associated with other critical symptoms. In cases of viral infections, antibiotics have no effect. The patient should consume plenty of fluids to prevent dehydration. In cases of heat stroke, non-steroidal anti-inflammatory drugs will not be effective. The patient needs to be cooled. If they are confused or unconscious, they should be treated by a doctor straight away. This is the basic information regarding elevated body temperature. If you have any questions, leave them in the comments.